Good to see you again.
Nice to see you too.
Thanks for coming in.
Of
I know we're
course.
coming at you with a million questions.
That's okay.
Today.
You know, the United States almost stands alone among all industrialized countries in the world by having 3 times higher maternal mortality than any other industrialized country, and being the only industrialized nation whose maternal mortality rate is actually rising. And it turns out that 2 to 3% of pregnancies are in people who have heart disease, and yet it accounts for 1/3 of the deaths. We are in an evidence-free vacuum of understanding how to care for these patients, how to define their risk, and what treatments are best for which types of patients. So this is the first ever grant in the United States to prospectively enroll pregnant people with heart disease, to understand at the time they present their risk factors, to monitor how they're treated and what their outcomes are, including their quality of life through a year after delivery.
But there's not a lot of information about how these questions, might track.
And this study is actually going to be prospectively collecting that data from the perspective of our participants. Do they feel respected? Do they feel their needs are being addressed?
Is it extremely limited or has it?
And we know that social demographics, environment and healthcare literacy and education and insurance access and food security and financial, all of these factors substantially influence mom's risk around pregnancy and the postpartum. And so this will be an effort to more consistently evaluate that and to shine light on the social piece that we need to address to wrap around care for mom during pregnancy, postpartum, and hopefully thereafter.
For taking a few minutes, and remember, this is for the purpose of the study, so it's not going to, impact your care.
We really don't have broad information about the way that care is delivered in different settings across the country. We know that there are also a broad range of ways that clinics and hospitals deliver care, how frequently they see moms, how often moms are recommended to have imaging. What we're really working to understand as a key aim of this study is how to best standardize that care across our country in an effort to offer more optimal outcomes.
We're deeply committed and hopeful that we will make a huge impact on the care of pregnant people with heart disease. And given how disproportionate the maternal mortality rate is in America, how much this subset of patients accounts for that, and the extraordinary racial and socioeconomic and rural disparities in pregnancy outcomes. If we're successful, then I'll be able to retire incredibly happy with how I've devoted my life.